We want to get back, though, to that breaking news we brought you at the start of this newscast. A Texas A&M student being monitored for coronavirus. To talk a little bit more about the virus, what this could mean, we have Dr. Diana Cervantes with us from UNT Health Science Center. Thank you for being here. And, you know, this is a relatively new virus. What do we know about it?
It is definitely a fluid and dynamic situation right now. And right now, there are boots on the ground to figure out what we are trying to understand about this virus. We know that it is a coronavirus, and that is a very large family of viruses that typically can cause mild disease. But there are some of these coronaviruses, so MERS, which is Middle East Respiratory Syndrome, and SARS, that have caused more severe disease. And it's part of that family of viruses. And the concern is that it has jumped from animals to humans, and that is what could cause that severity, and that's what we know right now about this virus.
Tell me a little bit about the symptoms of the virus.
So right now, the cases, of course, you have to think of it sort of as a tip of the iceberg. The cases that you're going to see are the ones that are going to be more severe, that are going to have shortness of breath, pneumonia, that are going to be hospitalized. Those are going to be the cases that you're really going to see, but there could be more mild disease. So there have been some cases that have been mild. And so with coronaviruses, you can see maybe runny nose, a sore throat, fever. That's what you will see. But then the concern is really for the people who could develop a more severe disease, that have chronic conditions, and they could develop shortness of breath and pneumonia and even die.
That kind of leads into what I was thinking about. I mean, is there anybody who is more at risk for developing the more serious version of this disease?
So there's always going to be people, the elderly, very young children who are under 3, for example, because their immune system, for example, aren't as robust, and they haven't been exposed. Children may not be exposed to as many viruses, but also people who have underlying chronic conditions. So if you have asthma or any other type of conditions like that, you are more at risk for developing more severe disease, and not just from coronavirus, but also just regular flu.
You know, and so we have our possible first case here in North Texas. We've seen a case that popped up in Washington State. How concerned should people be about this right now?
Right now, there's definitely a lot of action going on with public health and people who, this is really something that they do every day, is making sure that whenever something like this happens at a health department, they're out there working to make sure that they understand. They're going out contact tracing. So I would say the concern is really for people who may have traveled to Wuhan, and then within 14 days past that travel, they develop signs and symptoms. I would be concerned for those people, or people who may have been in contact with somebody who had traveled and had symptoms, and then they develop symptoms. But in general, I think because they are doing so much at the public health to prevent other people from getting sick, that the concern is very minimal.
How is it transferred, and how contagious is it?
That's something that really we don't know at this point. So they feel originally it may have gone from animals to human, and now that seems that there are some human-to-human cases, but it may be limited to people who have had very close contact. So maybe healthcare providers, people in the family. The worry is that is it going to be sustained transmission from person to person? So that's really what they're trying to figure out right now.
And before we go, just real quick, words of advice to people just to protect themselves in general from this type of an illness.
Just your general, always the good things that you want to do. You want to have really good hand washing, the same way you would kind of prevent a flu or a cold. Hand washing, keep your hands out of your face, don't touch your face, and then also make sure if you've had the travel to Wuhan and within 14 days you do have signs and symptoms, let your provider know. Give them a call before you show up to a hospital or to a provider so that they can make arrangements, and make sure that you do see your healthcare provider.
Really great advice. Dr. Cervantes, thank you so much for coming out here today.
Thank you.
Kim, we'll send it back to you.
Yeah, all great.